That's number one. You kind of reset.
Painful, tender to the touch. May also
Same shoulder length, and the other. Hey everybody, welcome back to another episode of Real Health with Brandi and Amir. I am
Brandi.
That's Brandi. That's right. I am Dr. Amir Rashidian, a chiropractor, and Real Health is, by the way, Brandi is the boss.
Not the chiropractor.
Not a chiropractor. Correct. Brandi is not a chiropractor. I am, and but she knows everything there is to know about health and wellness. Sometimes she knows more than I do, which is pretty impressive. But we like to keep up to date. That's why we read these articles on a regular basis, and we do some research and we try to get up to date and stay ahead of the trends and what's happening. And so that's what we want to bring to you. That's why the Real Health podcast started. This podcast is where we look at the latest trends, latest articles, what's in the news, what's being taught and given to people. And then we give you our perspective, which is the wellness, natural perspective, drugless perspective on how you can make sure you always feel better, get stronger, live longer, and feel younger. And so we have some good articles today. I had an eye exam earlier today.
How'd that go?
It went good. So I'm wearing, for the first time in my life, I'm wearing progressive contact lenses.
Oh, welcome to my world.
You wear those?
Mm-hmm.
You need reading glasses? My own wife, I never knew she needed reading glasses.
I hide my age well.
So when I was going to turn 40, which is almost 10 years ago, the eye doctor said, at 40, you're going to need reading glasses. And I said, no, I won't. And
you held to that.
I held off. And I said, I'm not going to need them till 50. Well, I am right now 6 months before my 50th birthday.
And here we are.
I caved in and got it. I was like, just the really small print is starting to get hard. She goes, yep, I told you. She told me at 40. So anyways, but it's good. My eyes haven't gotten too much worse. And they're actually better than they were several years ago.
That's impressive.
Yeah.
So.
And I've gotten used to these contacts. If I start reading funny, you know why. Because I'm wearing brand new
now
contacts.
Now he just has an excuse for his funny reading.
Funny reading is true.
Another.
So you want to jump in?
Let's do it.
Let's
we are starting to see more and more articles coming out on healthcare and technology, right? So whether it be, AI leading, patient records or recommendations, unfortunately.
Yeah.
In new kinds of implants, neuro implants. And here, our first article, we're talking about, cyber attacks and how that's affecting our healthcare world. So I think we're going to see more and more of these, as time goes on.
Unfortunately, there was a cyber attack on all social media last week.
Wow.
Where a lot of things were down, like Instagram and Facebook. Even YouTube, parts of YouTube were down, and they said it was an attack. It was a terrorist attack. We don't want to get into that right now, but this is from NBC News. The title is "Patients Struggle to Get Life-Saving Medication After Cyber Attack on a Major Healthcare Company." And this is recent. It says desperate patients around the country have been forced to choose between paying out of pocket for essential medications or foregoing them entirely as the aftermath of a cyber attack on a major healthcare company stretches into its third week. So it's been going on for 3 weeks now. The company's called Change Healthcare. It's a little-known but critical subsidiary of United Health Group, and they detected the attack on February 21st. Since then, pharmacies, doctors' offices, and patients say their lives and work have been upended by widespread outages in systems commonly used for medical billing and insurance claims. So that's a little scary.
Well, I'm, knowing that we're in a world where there's so many cyber attacks and that potential is so high, I'm really surprised that more of these companies don't have plans in place and redundancy and things like that to help ensure there's not such a delay.
Yeah.
You know what I mean? Like,
well, and we'll read about it in a minute, but I think they have insurance, which doesn't help. But I think they have insurance. And so the cyber attack basically is a terrorist group will hold hostage your data.
Right.
And then you pay them and they released that. And we've seen that in TV shows quite
Yeah,
a bit.
great movies
The
based off it.
hospital TV shows. What was it? What was it? Grey's Anatomy? What was it? It was one
Oh,
of
I don't
those
even remember.
where they held. No, it was The Good Doctor,
There you go.
because the guy's girlfriend solved it
Yeah.
and saved the day. Well, this person, Rhonda Miller, 54 years old, said she and her husband rely on a discount card to afford his insulin. He has type 2 diabetes and congestive heart failure. But when she tried to pick up his medication at the pharmacy in Deadwood, South Dakota, on February 22nd, the card could not be processed. Without it, the medication would cost hundreds of dollars. Now, the company Change Healthcare's technology is involved in transactions throughout the industry. The company says it completes 15 billion transactions a year, amounting to $1.5 trillion in health claims. Goodness.
Yeah.
On its website, Change said that the hack affected 21 parts of its business, including many that providers use to receive payments, get reimbursed by insurers, and process patients' insurance eligibility. So a lot of these doctors have had to do manual insurance verifications again, like the old days, and print and mail out claims to get paid. And some people
I know
are
all about that.
having a hard time. That's what we used to do. Yeah. United Health Group said in a statement that it took immediate action to disconnect Change Healthcare's systems to prevent further impact, and that the services would remain offline until we are certain we can turn them back on safely. The company said Tuesday that a new network connecting pharmacies to benefit managers could come online as soon as Thursday, which would have been last Thursday. The biggest effect in the community has been on patients who can't afford their medications without copay assistance cards. So again, this is hurting people who don't have the funds to take care of their health. And unfortunately, that population tends to need it the most, the medications. We've got people walking away from diabetes medication, antipsychotics, ADHD medication, etc. We had one woman yesterday who had to pay $1,100 out of pocket because the copay card wasn't working. Even patients who don't use copay assistance have faced immense challenges. Donna Hamlet, 73, a breast cancer patient at Florida Cancer Specialists and Research Institute, takes a medication called Ibrance that would cost her around $16,000 a month without insurance. But on February 23rd, she said a pharmacy told her it couldn't process her refill through insurance because of the cyber attack. Nathan Wackler, the CEO of the Florida Institute treating that patient with cancer, estimates that $350 million worth of patients' charges have been affected by billing delays due to the cyber attack. Now there's a cancer center that bills so much that this is affecting $350 million
Right.
of their revenue. How much are they billing? How much cancer is there in this country? Isn't that crazy?
It is crazy, but I'm also wondering, I'm like, why is it that my brain has already gone through a couple of things that we possibly could have done to help bridge the gap for these patients. I just wonder why we're allowing, if we, I can just think of 3 or 4 different things we could have done to get these people the information that they needed to the pharmacies to then be able to process that or do a delay process. We're putting, again, the cost of something in front of a patient's need. And we know what the cost of production of many of these pharmaceuticals are. We're talking about pennies on the dollar on many of these that they're now trying to charge thousands and thousands and thousands for this workaround. I just think it's nuts.
Yeah, I mean, the same guy, the CEO of the Florida Institute that's treating this cancer patient, said He worries most about patients who can't get their prior authorizations processed. Many insurance companies require them for cancer treatments, which can cost up to $100,000 per course. So, like, most of these cancer patients have like 10 courses of, for
Oh yeah.
example, chemotherapy. You're telling me that's $1 million right there. Now, there was a documentary, I think it was called The Truth About Cancer,
Mm-hmm.
and it talked about how much money there is in it.
Oh,
And every new diagnosis of cancer is worth $1 million to the institute that treats that patient.
it's a lot of money.
And they talked about how it almost financially, it seems they are disincentivized to find a cure
Because
because there's so much money in treatment. This is case in point. $350 million. That's like over 3 months or
right.
3 weeks.
And let's just put this caveat in there. We know that there are tons of researchers that really want to do that, right? They want to,
Oh,
they're working
absolutely.
hard. Those are not the individuals we're talking about. We're talking about the people who hold the purse strings.
Yeah.
Those are the people that get to really decide what information gets pushed through, what positive results we get to see versus negative results of, of these studies that are being done. Yeah. So it's not the researchers. Most of them have great intentions. It's the people who are making money that
the
are creating the
researchers
issue.
usually are begging for money.
Yeah.
They write proposals and grants, and the companies that fund them go, "Wait a minute, we'll make more money if we fund this other research, as opposed to a cure." Very sad. The Centers for Medicare and Medicaid Services on Tuesday encouraged Medicare and Medicaid programs to remove or relax prior authorizations during the outage and to consider giving healthcare providers advanced funding. So, and then the article goes on to say they started giving loans to some of these institutions, but this one person said this one office, the doctor said they needed $600,000 a month to operate, and the loan is only for $4,000 a month. So like 4,000 compared to 600,000 is nothing. Doctors, pharmacists, and industry experts say the hack has exposed major vulnerabilities in the health sector, particularly given Change Healthcare's dominance. So we shouldn't have one company that dominates
100%.
this whole thing. This is unrelated, but yesterday Trump said he doesn't want to ban TikTok in the U.S. anymore, because originally he wanted to ban TikTok because they're stealing a lot of U.S. data for China. He goes, if we ban TikTok, Facebook becomes the dominant force in this industry, and we can't have that. We need something to compete with Facebook, and so we shouldn't ban TikTok.
Well, it's like that in every industry. How many neighborhoods have we lived in that there was somebody had a monopoly on the gas service, right?
Yes.
Like the gas company owns the tank that they put into that neighborhood for everyone to draw from.
And they can raise their price.
And they do, and they raise their prices astronomically. Why? Because they can, because there's no other company competing with them for that pricing. And then who pays the price? Always the consumer, which is exactly what we're seeing here.
Yeah. Yeah.
It's pretty sad.
Money talks, unfortunately. There's a doctor, Mayank Amin, is the owner of Skip Pack Pharmacy in Skip Pack, Pennsylvania, said he and his staff have spent hours calling insurance companies to find out patients' eligibility manually, one at a time. The work has kept him up until 2 a.m. every night, he says. Now, you can relate to that, right? When we lost our staff. So 1 year, this was 2014, I herniated a disc in my back, 2 discs.
2 discs.
I couldn't walk, I couldn't breathe, I couldn't talk. I mean, it's tremendous pain. Couldn't practice. So we had to bring in a cover doctor to help us back then. I can't believe it's been 10 years since that. But within the next 4 weeks, I got 6 letters of resignation on my desk. Everybody quit.
Yeah.
Because they didn't.
I was
think
just
we'd be
telling
able to
this
get back.
story like 2 days ago. Yeah.
So Brandi had to do these insurance verifications. And after a few weeks, I mean, she's coming in early, staying late, working really hard, and I'm on crutches. I was on a walker for a while. And
I'm pretty sure I said that's it.
Yeah, I mean,
I'm
we
pretty much done.
basically said, forget insurance. We're not going to deal with insurance anymore.
Yeah.
It's very unethical because these insurance companies, and I don't mind saying this for everybody to hear. I mean, they would literally say, yes, that service is covered. We'll reimburse you.
Hmm.
So we would provide that service to the patient, and then they would change their mind
Yeah.
and say, actually, it's not covered.
Yeah.
Get the money from the patient. So now a patient has to get a bill from the doctor when before we just told the patient this is going to be covered. So what did we do? We ate it. I mean, hundreds of thousands of dollars were lost because of these insurance companies.
Hmm. Yeah, it was painful. Because the relationship with our patient was more important to us, than fighting.
Yeah.
And it was hard. It was
And
a hard
unfortunately,
time.
insurance companies are incentivized to not pay for claims.
They are. That's why they have a really great net profit each year.
That's how they make money, exactly, by taking premiums from their
Yeah.
clients
Yeah.
and not paying the doctor.
I actually just received an email, I think it was 1 to 2 weeks ago, that had the net revenue for like the top 6 insurance companies in the country. And I'm telling you guys, they did fine.
Net profit, right?
Net profit.
Yeah.
Yeah. And I'm telling you, it was in the billions.
Oh,
So don't worry, the insurance company, they are doing just fine. They have gotten their piece. They are floating. They're floating well. There's nothing we need to worry about where they're concerned. So.
Yeah, I mean, they keep raising the rates and lowering reimbursement. So that's from a money standpoint, good business. Change Healthcare said the perpetrator of the cyber attack represented itself to us as ALPHV, ALPHV / Black Cat. ALPHV was involved in the attack on MGM Resorts last year, costing the company $100 million. It is developed and maintained by a group of Russian-speaking cyber criminals. They don't want to call them Russians. They just want to say they're Russian-speaking. Because I guess other countries speak Russian.
Yes, that's true.
In total, last year, victims of cybercrime sent a record $1 billion in extortion payments to ransomware criminals, according to Chainalysis, a company that tracks cryptocurrency payments. I'd like to work for them. That sounds like fun. I mean, they're basically tracking this stuff, reporting on it. United Healthcare didn't answer questions about whether it paid a ransom, but experts at the cybersecurity company Recorded Future, that's the name of the company, Recorded Future, and the cybercurrency analytics company Tenable pointed to a Bitcoin wallet that received a payment of more than $22 million on Friday. The companies say the wallet, which was viewed by NBC News, belonged to ALPHV.
Wow.
And that was reported first by Wired.
So they're saying there's evidence to speak to United possibly paying this terrorist group $22 million.
Yeah. And it hasn't solved the issue. Because it's the
Good thing I know that their net profits were okay last year.
Yeah, it didn't hurt them. Cybersecurity expert Eric Noonan, the CEO of CyberSheath, said that if United Healthcare did pay ransom, it's a terrible precedent because what it now does is say this is a viable market. Noonan said United Health needs to address whether patients' personal information has been compromised. Thus far, the company has said only that its teams are actively engaged and working to understand the impact. There you have it. Cyber attack.
So it's terrible. It's happening more and more.
Next article is from U.S. News. It's about spring allergies. And I guess spring came early this year.
It did.
And
it's feeling pretty nice out today.
You don't get allergies, right?
I do not have an issue with allergies.
Yeah, I don't either. So my heart goes out to you guys who do.
There's a lot of you.
That's right. So
there are some really great things, though, that we can share during this that can help with that. So there are some natural things that everybody can be doing to build their body's immunity to some of these allergens that are in the air.
Hopefully we can be of benefit to you. The title article says spring allergies have wide-ranging effects. Spring allergies bring to mind thoughts of stuffy noses and watery eyes. But allergies actually affect many different and interconnected systems within a person's body, according to the American College of Allergy, Asthma, and Immunology, the ACAAI. And those include asthma and eczema. And they talk about different types of allergies, like nasal allergies, which from pollen can cause things like sneezing, itching, nasal congestion. Asthma flares from pollen or other airborne allergens can trigger a full-fledged asthma attack, producing wheezing, coughing, and difficulty breathing as airways tighten. And eczema, spring allergens, can combine with warmer temperatures to cause eczema, skin flare-ups. Eye allergies, red swollen eyes, seasonal allergic conjunctivitis, itching, redness, burning, watery eyes, dark circles under the eyes, and puffy eyelids. So, and they're saying that it's you don't have just one; you're gonna have multiple ones. Like if you have the watery eyes, you also have a runny nose, and if you have the nasal allergies, you probably also get the asthma as well, or you're more susceptible to it. And so they tell you to do a few things, like get the right symptom reliever, which they recommend antihistamines, nasal corticosteroids, and bronchodilators. So obviously we know bronchodilators are for asthma.
Correct.
Your bronchioles dilate, so bronchodilator like an albuterol inhaler. Antihistamines, we're going to talk about that a little more in detail, what antihistamines do, because they block the histamine receptor. They don't stop the production of histamine. So
Right.
we'll tell you why that is. And corticosteroids reduce inflammation. So it's a steroid. It's just like a steroidal anti-inflammatory, but for the nasal passage, and reduces inflammation, nasal passage, and the sinus mucosa. So they're saying use those, and they're also saying use moisturizers for eczema and artificial tears to wash away the allergens from your eyes. Now we did a podcast report on the tear drops, the eye drops that were
Yeah.
causing serious things. So
Yeah.
and
Remember that your eyes have their own immune system.
yeah.
And so it's separate from the rest of the body. And
Yes, don't get a off-brand. Don't
yeah,
make sure you
be
don't put
super
anything that's
cautious.
expired in your eye. And if you want more information, go back and watch that episode on our
Sure.
podcast.
Maybe Sean can provide the link to that one in the
We'll have to figure
comments.
out
We'll have to see if we can find that.
which one that was. Yeah.
For listeners not on YouTube, it is episode number 27.
And then they also say avoid the allergens, like keep windows shut and keep out the pollen. I don't know. I mean, that's like
not going out to enjoy the spring weather.
I know, it's
That
sad.
sucks.
They also say take a shower at night and wash your clothes after being outside. I mean, you should wash your clothes anyways, but
That's usually recommended
It-
at some
it-
point.
interesting. Do people not wash their clothes?
I'm assuming that could be a thing if it's in here.
I had a friend who had an old pair of jeans he would never wash.
Oh, that's interesting.
He said they were like super expensive jeans, and he said the manufacturer says you're not supposed to wash them, so he'd never washed them, ever. I don't know. See, but he didn't have allergies.
I have
so.
a lot of thoughts about that.
Wash your clothes. See an allergist. They say a board-certified allergist can detect your specific allergens. They might even suggest allergen immunotherapy, which can provide long-term relief by modifying your immune system's response to specific allergens. So let's go back to those antihistamines. You actually have three types of receptors for histamine. You have H1, H2, and H3. When histamine hits your H1 receptor, that's when, so histamine gets released by these cells in your blood called mast cells. Mast cells will release the histamine, and then the histamine goes and hits these receptors, and the response to that is the immune response, which is watery eyes and runny nose and eczema and asthma and all the other stuff. Now, what happens to the H2 and H3 receptors? Well, if the histamine hits the H2 receptor, you end up with digestive issues like heartburn, acid reflux, indigestion. And if it hits the H3 receptor, you get mood swings, depression, and sometimes anxiety.
That's fascinating.
So now when you block the H1 receptor, which is what antihistamines do, more of the histamine goes to the H2 and H3 receptors. So that's why people with allergies take a lot of antihistamines. They end up with heartburn, acid reflux, indigestion, and depression and mood swings, which raises the rates of stomach over-the-counter medications, and
That's
like
fascinating.
antacids and antidepressants as well.
I wonder if there's any link to the seasonal affect disorder. Do you know what I
Well,
mean? I would love to see the stats to see if the larger number of people who have been diagnosed with seasonal affect, if they also have been
but
prescribed
usually those
antihistamines.
people are depressed during the winter months,
True.
which means they don't have allergies during that time.
That's true. Huh.
So
Fascinating.
I think that's more of a serotonin issue.
Okay.
Now, the SSRIs, serotonin uh, reuptake inhibitors, um, they don't increase serotonin levels in the body. So you want your body to produce more serotonin. Some of the serotonin is
Gotcha.
produced by the brain, a lot's produced by the gut. So a lot of times a good probiotic will help get rid of seasonal affect disorder.
That's really cool.
Better digestion improves that because it increases serotonin levels.
Okay. That's good information.
Yeah, which is why a lot of people on antidepressants have to stay on antidepressants for the rest of their life.
Right.
They don't get cured by it. But I think if you get your body to produce more serotonin, then you probably would need the medication less. We're gonna get crucified for this.
That's okay.
Don't say this stuff. But anyways, antihistamines, be careful. So there are natural supplements, and I don't know if we're allowed to mention natural supplements or promote certain products or whatever.
Sure.
So I'll just tell you, there are natural supplements that actually will use your own liver to remove histamine. So it's not a histamine receptor blocker.
Correct.
What it does, it teaches your body how to remove the excess histamine from your blood so that not just the H1, but H2 and H3 don't get hit. And there are other supplements that over a long period of time, we're talking 3 to 5 years, you take it daily during allergy season every year, and over the next 5 years, your mast cells will produce less histamine. So not only do you excrete the extra histamine, but you produce less. And I think the combination of the two has been worked well. And we have quite a few patients who say, "Oh my gosh, it's been a game changer. I don't need the antihistamine. I don't get drowsy. I feel
Exactly.
great." And there's other benefits to these supplements as well. So
There's also, and many people know this, that also getting local honey from your area, and taking a teaspoon of that every day.
why does it have to be local?
Well, because that's the pollen that's in your area, and that's what the bees have been
Yeah.
using. So by doing that, it's like microdosing,
Exactly.
right? You're taking small doses of that to allow your body to build up the immunity and what it needs to be able to fight against those.
Yeah, eat a teaspoon of honey, locally produced honey. The more local, the better.
Yep.
And that's not an instant fix. Again,
No,
you have to do
it
that.
takes time.
You basically do that every day for the next several years, and little by little, your body gets used to the local pollen.
Yep.
Um,
So if you're new to an area, it's really important to do that. So
yeah.
if you're just moving here, there's lots of great opportunities to get some good honey and start your microdosing now.
Right on. And honey tastes good. I haven't had honey in a long time. It's not in my diet plan
It's
right now.
not. I actually was having a little bit of a sweet craving the other day. So in my coffee, I had some spicy honey and I drizzled that on.
That's right. We got it from that farm, didn't we?
It was so good.
Yeah.
So I had a little bit of spicy sweetness to my coffee.
I'm jealous. Next one, CNN. This is from CNN Health. FDA approves first treatment for severe frostbite. And I don't think frostbite is a big issue. And also it's warm now, so we're not going to get, but
it's kind of cool to see, how some of these treatments are progressing or what they're doing differently.
Yeah.
Because they didn't always have an answer or a
no, I
solution
mean,
for
frostbite, people lose their fingers,
Right.
Fingers and toes, and sometimes a whole limb. The U.S. Food Drug Administration on Wednesday approved the first treatment for severe frostbite to reduce the risk of finger and toe amputation in adults. The drug is called Iloprost. It's an injection marketed under the brand name Orlumine.
So much easier.
Why can't it be like anti-frost?
Right. There you go.
Or frost don't bite. Well, let's name it that. I'll change the name. It's a vasodilator. a drug that opens blood vessels and prevents blood clotting. Now, we got to be careful with vasodilators. Like, one of the causes of migraine headaches is vasodilation in the brain.
Right.
So I'm sure there's some side effects to it. This doctor, he said, it's a game changer, in my opinion. This is Dr. Peter Hackett, a professor of medicine. And look at his specialty. He specializes in high altitude and wilderness medicine.
So cool.
I didn't know that was a specialty. Like, what's the acronym
It
for
sounds
that?
like a true niche.
Like, yeah, like, I'm a cardiologist. What are you? Oh, I am a high altitude wilderness medicine specialist.
Which is very different than a low altitude wilderness specialist, I'm assuming.
Yeah, wow. Yeah, well, he's both. He's
Oh.
a high altitude medicine specialist and a wilderness medicine specialist. He does both.
Yeah, but maybe he's not a low altitude.
Which one of those has to do with frostbite?
Who knows? I'm assuming high altitude. Well, you can get cold and frostbitten in the wilderness.
Yeah, you could be at sea level. You could be below sea level and get frostbite.
This is all very interesting.
Anyways, we're just having fun with this guy. I wonder how many wilderness medicine specialists there are in the world. I never knew there was such a thing.
I think there has to be at least 2 for it to be a department.
They
actual.
They treat frostbite. Frostbite happens when skin and underlying tissues freeze, limiting blood flow to the area. Early symptoms include skin redness and pain, followed by numbness and white, grayish, yellow skin discoloration. I was camping in Utah. Do you remember this? You weren't with me. I was alone. And so my tent, my sleeping bag, and everything I had was rated for 34-degree temperature. And I was like, I should be fine. It was June, but we were up high in the mountains in Utah. Now, in the day, it was like 85 degrees and
beautiful.
bright, sunny, hot. You're wearing shorts, t-shirt, and even that's hot. But at night, it got down to like 20 degrees.
You were cold.
I was freezing. I couldn't sleep. My fingers, I had like 3 socks on and my boots and gloves, and my fingers were hurting. And I was so thankful because I knew if I couldn't feel pain in my fingers, I was getting frostbite. As long as they're not numb, I knew my fingers and toes would survive. The next day, one of the other campers gave me those little packets you put in your socks that warm your toes. I slept that second night. Mild frostbite, also known as frost nip, does not cause permanent skin damage. However, severe frostbite can lead to permanent damage and require amputation. There are not many effective treatments for severe frostbite. In recent years, physicians have tried other clot-busting drugs to save frostbitten fingers and toes, but these medications come with a high risk of bleeding and are effective only within 24 hours of the injury. In contrast, iloprost does not carry a risk of bleeding and can be used up to 3 days after the injury. Iloprost was originally approved in 2004 in the U.S. as an inhaled medication to treat pulmonary arterial hypertension, a type of high blood pressure in the lungs. So it's been used, but now they're using it for something else, which is frostbite.
This comes at a good time because what I heard on the news recently was that they now, for hikers that are going up Everest, they now have GPS trackers that every hiker is actually required to rent, and they put the tracker in their coat pocket. And so if by chance there's an accident or somebody gets lost, everybody now has a GPS tracker so that they can reduce the time of finding them and getting them the help that they need. So with that, combined with that, I could see the importance. It's pretty cold up there, I heard.
Yeah. That's neat. It'd be nice if it transmitted vital signs as well.
Mm-hmm.
So if someone starts having a heart attack.
That's probably next.
Yeah.
Right? Would be my guess.
I'm like, why would you get lost? Because there's a path they all take, and they're guided. Like, I guess
but
if
if
they
there's
go on
an
their own,
avalanche or anything like that
makes
happens.
sense. If they're buried under snow.
Yeah.
Yeah, I'm not interested in climbing Mount Everest.
Mm-mm. Nope, I've watched a lot of documentaries about it, and I'm amazed. It's a marvel to see somebody do that. I have absolutely zero desire to be the one.
Yeah.
I'm sure it's an amazing view.
Yeah.
But
I mean, I grew up below sea level. So like low oxygen is not going to be good for me.
Right. Oh, well, we know that because we went to a friend's wedding years ago in Colorado.
Yeah.
You and I weren't even thinking about it.
Mile
Jumped
High
on the
City.
treadmill,
Yeah.
and we were both dying.
Well,
And we were
remember
like,
when we were camping up in the for Total Solution? This was 8,000 feet above sea
Yeah.
level on a mountain. It was a campground, and we were there for a conference. And Brandi goes, "Let's go for a hike." So then she came and found me, and I was out of breath. And she goes, "Did you go on a hike without me? Because you're out of breath." I said, "No, I just got out of breath trying to put my shoes on."
it's what I felt like 8 months pregnant, basically.
Right. So, but I grew up in Iran, up north by the Caspian Sea. Caspian Sea is 90 feet below sea level.
Yeah.
So it's one of the highest concentrations of oxygen. You're basically like in a hyperbaric chamber when
That's
you
pretty
grow
cool.
up there. Yeah. So I don't know if it's a benefit or not. Common side effects of iloprost include headache, flushing, fast heart rate, nausea, vomiting, dizziness, and low blood pressure resulting from the dilation of blood vessels, according to the FDA. Yeah, so this is one thing though. It's nice because even if you have side effects, you just take it till the frostbite goes away,
And then you're done.
and then you're done. So until blood flow is restored, so that's good. He said that the same guy, Dr. Hackett, says, really, frostbite is an injury that needs to be prevented, not treated. I love that. And you're like, just wear
Yeah.
nice clothes. People should have proper clothing, equipment, training before embarking on cold weather outdoor activities, he said. So I guess that's the knowledge he got from his specialty in wilderness medicine, is preventing. He's pretty smart.
Yeah,
I'm sure
I
he
would
knows
agree.
more than that, but
Do we have time for one more?
I don't know. We've been talking for a while. We can save
can
this for
save that till
later.
next time.
We've got some good ones still here. There was a controversial ad in the Super Bowl. This is an old article, but I saw it and I thought maybe we could just chat about it because it's interesting how socially people respond to news,
Yeah.
certain ads, and so on. We have an article on bloating, but I don't know if people are interested in that one. And then this one I think is going to be a good one because it's talking about how a lot of teenage young girls are using the wrong skincare products because they're promoted on social media.
Well, and we've seen this so many times is
Yeah.
these weight loss
Fads.
products or
Yeah.
any of these fad-based products. We put them, we'll see them out on social
Yeah.
media and people are like, "Oh, it's out there, so it must be great." Let's just remember nothing on the market like that is being watched or investigated. We
Right.
don't know if something is bad until there's a negative result, and so or a negative report.
Yeah.
So the old adage, you can't always believe what you see, right? It's not, you really need to do your research on stuff. Make
Right.
sure you know where the ingredients are coming from. If
Yeah.
you can't even pronounce the ingredient, you might want to think twice about putting that on your skin or in your body. So we'll talk a little bit more about that the next time.
Yeah, we'll tell you what to look for. So if you have children, because this is mainly affecting young people.
Yeah.
If you have kids, you know what products or ingredients not to put on their skin.
Yeah.
But hope you enjoyed it. We had some good conversations going from cyberattacks to FDA and approval of drugs for different things like frostbite, which hopefully is not affecting your life, but it was fun to talk about.
Yeah.
Good show.
Thanks. We should do this again.
See you next week.
Bye.